Hi everyone, welcome to Evolve 101 Health Tips. And this is where I share tips on various diseases that you can use at home to help yourself. I must say that the information shared here is not a replacement for your doctor's or your medical care provider's advice. So, the first disease we'll talk about is diabetes. Why? Because this is a disease that is becoming more common as the years go along. In fact, the World Health Organization says as of 2014, we have over 422 million people now suffering worldwide from diabetes. So you want to pay attention to diabetes. The information I'll bring to you in diabetes will come in 5 separate videos. So this is video number 1. We'll talk about the definition of diabetes and the risk factors. How do you know at home, or how do you know that you may be at risk of developing diabetes? The second video will talk about the symptoms, how you feel at home, some symptoms that you may have that may make you start to suspect that you may actually have diabetes. And then we'll also talk about how your doctor diagnoses you with diabetes. In the third video, we'll talk about treatment options by your medical care provider. In addition to that, we'll talk about the foundation of diabetes, which will be the nutrition and how you can help yourself at home. In the fourth video, we'll talk about the medical complications, what diabetes can do to our bodies if we are not careful, or if we don't pay attention, or if the diabetes stays uncontrolled for too long. And then lastly, the last video, video number 5, we'll take questions and answers from you about diabetes. So video number 1, what is diabetes and what are the risk factors? Diabetes is a disease that affects how your body affects sugar, so glucose. There are 2 types of diabetes, diabetes type 1 and diabetes type 2. Type 1 diabetes mainly affects people starting from a younger age, 7 years old, 8 years old. These people have a disorder where they do not produce enough of the hormone called insulin. For the purposes of this video, we will focus on diabetes type 2. And this is the kind that affects mainly adults. Of course, now with obesity, which is now prevalent in childhood, we are now seeing diabetes type 2 in younger people, so younger children down to age 11 and 12, mainly because of their weight. So what is diabetes? Diabetes is a metabolic disease, so it is a condition that affects your whole body, and the hallmark of diabetes is high blood sugar. So how do we know that we have diabetes, and what are the risk factors for diabetes? And this is where it is important for you to know your family history. What kind of illnesses did mom have? What kind of illnesses did dad have? What kind of illnesses do your siblings have? So you want to know their illnesses, because diabetes is one of those diseases that is familial. So if your father or your mother or both or your siblings have diabetes, that puts you at a higher risk of developing diabetes also. So how really do we come to become diabetic? Especially diabetes type 2. I am strictly talking about diabetes type 2. Again, this is a disease that is characterized by high blood sugars. So most of us, we are at risk of becoming diabetic when we are overweight for too long. Obesity and overweight is a major risk factor for diabetes. And how does that happen? When you eat foods that are high in sugars or high in fat, your body takes the excess food as in energy and it stores it as fat. The heavier you become, then the higher the risk of you developing diabetes. Why is that? It's because of a hormone called insulin. That hormone is responsible for taking the energy that we have consumed, breaking it down into glucose that we can use to walk around or to keep our brains alive. And then, if the energy is too much, our body now stores it as fat. Those of us who are overweight or obese, we have too much insulin floating around. So, again, the kinds of foods that you eat will put you at risk of becoming diabetic. What kinds of foods are we talking about? We're talking mainly about starchy foods or sugary foods. So, foods that are starchy. For those of us who are in Africa, I'm going to name a series of foods that you can recognize. So, things like rice, you eat too much rice, you eat too much fufu corn, too much corn, too much cocoyam, potatoes, too much. I'm not talking about eating just enough. I'm talking about eating too much carbohydrate, or you're drinking too many sugary drinks. For example, you're drinking too much beer, you're drinking too much Coke, Fanta, Sprite, putting too much sugar in your tea. That gives you too much energy, and when your body has too much energy, it stores it as fat. Now, how do you know, even without knowing, that your foods have too much energy? Now, if you are overweight, if your weight is too much, you're carrying too much weight around, you already are at higher risk of becoming diabetic simply because you are overweight. So you must start to think about ways of reducing your weight simply by reducing first the amount of food that you are eating. So what have I just said? Number one, we are at higher risk of becoming diabetic based on a family history, and seeing that we cannot change our family history, then we can change our own behavior. Diabetes is a disease that can come to us, or we can develop diabetes based on our behavior. So if we eat too much food, or if we eat too many starchy foods. So the starchy foods are, again, things like fufu, eating too much fufu, eating too much rice, too much cocoyams, things like bread, crackers, cookies, biscuits, too much puff puff, all these foods that have too much starch, too much flour, they cause us to gain weight. And when we are carrying all this weight, we have a higher risk of becoming diabetic. Now, there are some of us who are not overweight, but we become diabetic anyway. But most of us, the biggest risk factor for developing type 2 diabetes is being overweight and obese. So if you are overweight, it's very important for you to start changing your diet, cutting back on starches. Stop eating too much puff puff. Let's say you go to the market and you buy puff puff. You should not take sugar and sprinkle on your puff puff. That is not good. It gives you too much energy, puts you at risk of gaining weight, and you can become diabetic. Diabetes is a serious condition that we must pay attention to. If you have any questions, please type those in the chat box. If you have not subscribed yet to my YouTube channel, please go to Dr. Inaka Yembe TV and subscribe to my channel so that when I put out a video like this one, then you get that information immediately, or you get a notification. Again, diabetes is a metabolic condition, so it is a disease on the inside of our body where we have high blood sugar that circulates through our body, and it causes a lot of problems, which we will discuss in the next videos. I hope this information gives you some insight on some idea on exactly what diabetes is. In the next video, we'll talk about the symptoms, meaning how do you feel? What kinds of symptoms or what kinds of things do you feel in your body that can make you suspect that you are a diabetic or you may be becoming a diabetic? Thank you.